Mental illness is classified as a disorder that affects your mood, thinking, and behavior. Mental illness is a broad classification that includes eating disorders, depression and anxiety disorders, schizophrenia, and many more. Reasons for mental illness are not definite, but scientists believe one reason is that nerve cells in the brain do not function properly. They may not process correctly, which could lead to behavior or mood problems. PET scans can monitor where brain activity is most active and if neurotransmitters are functioning too little or too much. One example is dopamine is not pumping enough and one feels sad or down. Studies show that 1 in 5 teens suffer from a mental disorder and that severe mental problems are more common than asthma and diabetes. Of the mental illnesses, depression is the most common among teens, with 10 to 15% of young adults having some symptoms of depression at any one time. Because it is so detrimental to your day-to-day function and ultimately to your health, it is important to educate everyone on the importance of being able to recognize the signs.
Lola, a former straight-A student, has begun to cut class and continues to watch her grades drop. She is irritable and angry and is withdrawn from her friends and family.
Hey, Lola.
She instead chooses to stay in her room and play on her phone all night. She feels a lack of pleasure and motivation when it comes to doing things she used to have a passion for, like playing with her dog. She has very low self-esteem and feels no self-worth, and has recently had suicidal thoughts.
Lola, you look so pretty today. No, I don't. I hate myself. I'm so ugly.
She has also lost an excessive amount of weight due to changes in her eating and sleeping habits.
Lola, do you want this popcorn? Yeah, thanks. All of these are signs of depression. However, if it goes unnoticed or untreated, I could carry this depression with me through my adulthood. Unfortunately, it could also end in suicide if the issue is not addressed. Studies show that kids aged 12 to 16 years old, 30% have considered suicide, with girls attempting it 3 times more than boys. It has also been proven that 50% of adult mental disorders developed in adolescence, which is why it is so important to discover it while you are so young and it can be treated.
Depression varies in adulthood and adolescence. Adults will often withdraw from those around them and become more isolated. However, teens, while withdrawing to a degree from adults in their lives, will also continue to associate with their close friends.
Hey Lola.
Hey!
In addition, teens may experience changing sleep patterns but will often find time to sleep, while depressed adults may develop insomnia. Teens express their feelings through anger and irritability, while adults often are more sad and withdrawn.
Thankfully, there are some treatments for depression. Depressed adolescents that opt to take medication improve more rapidly than adults and are found to have more hope when it comes to recovery. However, teens can react differently than adults to the antidepressants, often developing a greater risk to experience suicidal thoughts.
Antidepressants work by boosting the neurotransmitter serotonin in the brain, which reduces depression. Other treatments include electroconvulsive therapy for major depressive disorders, transcranial magnetic stimulation, and light therapy for specific subcategories of depression, like seasonal affective.
After a time, treatment was successful and Lola was back to her normal life.